Have you ever felt a fatigue that seems to have no explanation? That weakness that doesn't improve, even when you sleep well and swear you're eating right? If this is happening to you, I want you to pay attention because sometimes the body isn't making you lazy. It's silently warning you that an essential piece is missing: vitamin B12. I am Edu Rodriguez, a pharmacist, biochemist, and health educator. And in today's video, I will clearly show you the most important signs of vitamin B12 deficiency, why this is so common after the age of 40 and 50, and what you should do to investigate the right way, without paranoia and without self-medication. And let me tell you something important right off the bat. This content is educational and does not replace a medical consultation. My goal here is to help you recognize patterns and communicate better with your doctor with more information and less doubt. Vitamin B12, also known as cobalamin, is a small vitamin in name, but has a giant impact. It plays a role in the production of red blood cells, protects the nervous system, and helps form the DNA of cells. In other words, it's energy, it's brain, it's nerve, it's blood circulating properly. The problem is that B12 deficiency often creeps into a person's life slowly, almost silently. And that's why so many people live for years with symptoms that disrupt work, mood, memory, sleep, energy levels, and even safety while walking, without realizing that the reason could be there in a vitamin that no one remembers to ask for in their tests. And here comes a point that I see happening a lot. A person starts to feel tired, unmotivated, somewhat disconnected, and the explanation always becomes the same. It's age, it's stress, it's the rush, it's anxiety. However, in many cases, the body is signaling for help in a biochemical way. It's not a whim. It's not a weakness of character. It's physiology. Let's go step by step. One of the most important, and at the same time most confused, symptoms is anemia due to a lack of B12, called megaloblastic anemia. What does this mean in practice? It means that the body cannot produce healthy red blood cells properly. And without well-functioning red blood cells, oxygen reaches the cells poorly. And when oxygen reaches the cells poorly, you feel it in your body. Constant fatigue, paleness, shortness of breath with exertion, muscle weakness, that feeling that everything weighs more than before. Climbing stairs feels like a marathon. Walking a little makes you want to sit down. And the most deceptive part, you sleep, but it doesn't feel like you're recharging. Many people think this is iron deficiency and rush to take iron on their own. However, when anemia is due to a B12 deficiency, iron does not solve the main problem. It can even confuse, delay the diagnosis, and let the real cause go unnoticed. And when the brain starts receiving less oxygen, or when the nervous system begins to suffer, frightening symptoms appear. Vitamin B12 is essential for keeping the nerves protected. It helps in the formation of the myelin sheath, which acts as insulation for the electrical wire. Without this protection, the nerve becomes more vulnerable and the signal does not transmit correctly. It's like a frayed cable making poor contact. And then the neurological signs begin. Tingling in the hands and feet, numbness, loss of sensitivity, a feeling of electric shocks, difficulty with fine coordination, and even a strange perception that the foot does not step confidently as before. Cognitive changes also appear. Memory lapses, difficulty concentrating, a feeling of a slow mind, as if reasoning is heavy. Sometimes a person describes it as a mental fog. And for those who work, study, or need to maintain focus, it becomes a daily struggle. And there's more. A lack of B12 can mess with your mood. Unusual irritability, sadness without a clear reason, anxiety that seems to have come out of nowhere. I'm not saying that all anxiety is due to B12, of course not. But I am saying that there is a biological mechanism here that many people ignore. B12 is involved in processes related to neurotransmitters. When it's low, the brain can feel it. And this is a very important point. When the deficiency is prolonged, some neurological damage may not fully reverse. That's why early identification makes a difference. Now, there's a side that few people mention, the heart and blood vessels. A deficiency of B12 can increase homocysteine, a substance that, in excess, can be associated with greater damage to the arteries. This is silent. It doesn't cause pain at first. It doesn't alert you with an alarm. But over time, it can contribute to cardiovascular risk in some people. That's why, especially after the age of 50, It makes a lot of sense to talk to your doctor about evaluating B12, folate, and, in some cases, homocysteine, especially if you already have other risk factors like type 2 diabetes, hypertension, a family history of heart attack or stroke, smoking, or if you experience symptoms that align with deficiency. There is also a fourth group of symptoms that can be quite alarming: balance and coordination. When a lack of B12 affects the spinal cord and peripheral nerves, a person may start with mild tingling and, over time, notice that they trip more often, that their leg feels heavy, that their walking is different. Sometimes a person feels insecure about going downstairs, feels their body is less steady. And this is not normal for age by definition. Age can bring changes, yes, but unexplained loss of balance needs to be investigated. And B12 is one of the possible causes, especially when it comes along with other signs. Now I want to show you some signs that are more visible and that many people don't connect. One of them is a painful red tongue, which can become smooth, sensitive, and sometimes have a burning sensation. This happens because the mucosal cells need to renew, and without B12, this process is impaired. Another sign is the little sores in the mouth, the famous canker sores, which may appear more frequently in some people. It's not exclusive to B12, but it can be part of the picture. Dizziness and palpitations can also occur, especially when anemia is present. The person stands up and feels their heart racing. They feel a strange weakness. It gives that sensation that the body is trying to compensate for something. And there's a detail that many people describe but don't give importance to: paler skin and nails, or even a slight yellowish tint. In some cases of B12 deficiency, there can be early destruction of red blood cells, releasing substances that alter coloration. It's not about diagnosing yourself in the mirror, but about adding this to the rest of the picture. What you need to understand is that these symptoms may seem disconnected: fatigue, memory issues, tingling, canker sores, tongue issues, dizziness, paleness. But when you look through the right lens, everything can be linked to the same root: insufficient B12. And here comes the question I hear the most. Edu, but I eat well. How can I be lacking B12? And here's the game-changing answer. Often the problem isn't how much you ingest, it's how much you absorb. For B12 from food to be well absorbed, the stomach needs to produce a substance called intrinsic factor, and over the years, this can decrease. Additionally, people with atrophic gastritis, certain autoimmune diseases, stomach surgeries, specific intestinal problems, or prolonged use of certain medications may have worse absorption. There are two medications that frequently appear in practice: drugs used for long periods for reflux and gastritis, and metformin, which is very common in type 2 diabetes. This does not mean that a person should stop the medication. Not at all. It means they should monitor with their doctor, as they may need to track B12 levels over time. And of course, those who are vegetarian or vegan need to be especially careful, because B12 is mainly found in animal-derived foods. Those who do not consume it usually need a fortification strategy or guided supplementation to maintain adequate levels. And now comes the good part. A deficiency of B12, when detected in time, usually has a simple and effective treatment. The right path begins with a blood test and clinical evaluation. Sometimes, in addition to B12, the doctor assesses folate, a complete blood count, and, depending on the case, metabolic markers. The type of supplementation varies according to the cause. In mild cases with good absorption, oral use may work. In cases of malabsorption or significant deficiency with neurological symptoms, the doctor may opt for other forms of supplementation. But I need to be very direct here. No self-medication. Oh, but it's just a vitamin. Even a vitamin can disrupt the body's balance if used indiscriminately, in addition to masking problems and delaying diagnoses. The ideal is to investigate and treat with supervision, especially if you already have neurological symptoms or anemia. Now I want to make a practical invitation for you. If you identified with this set of signs: unexplained fatigue, weakness, tingling, forgetfulness, dizziness, paleness, sore tongue, mouth sores, don't wait for it to pass on its own. Take this to the doctor's office. Ask for an evaluation. Talk to your doctor about vitamin B12, folate, and whatever else makes sense in your case. And even if you don't have strong symptoms, if you are over 50, or take certain medications for long periods, or follow a diet without animal products, it makes sense to be more vigilant with routine exams. because taking care of things early is always easier than chasing after damage later. And now I want you to do two very simple things. The first, subscribe to the channel and turn on the bell. I have a lot of practical content here to help you understand health without complications. On Monday, comment below one thing. Do you feel more tiredness, more tingling, more forgetfulness, or more dizziness? Just one word helps me understand which concerns are more common and which videos I need to record next. And if you know someone who is always complaining about tiredness, weakness, slow thinking, and tingling, share this video. Sometimes a simple piece of information can shorten months or years of silent suffering. Again, this is educational content and does not replace medical consultation, but it could be the push you needed to investigate in the right way. I'll stop here. Take care, stay with God, and I'll see you in the next video.